All right. Good afternoon, everyone. Thank you for being here today. We're going to go ahead and get started. We still have people coming in. We have a big attendance today, so we're glad you're here. Today, we are going to be talking about SSI and SSDI, and we have the infamous Andy Hardwick with us today. And so we are definitely excited to have him here with us today. He has got over 30 years with the Social Security Administration. Isn't that right, Andy? How many years are you at
40,
now?
over 40.
Better. Okay. Well, I didn't want to date you there. So anyway, all right. So,
Well,
so anyway, Andy has an extreme knowledge of all things from the Social Security Administration. And so we're very excited to have him here today. So from a housekeeping perspective, we can't see you and we can't hear you, but we know you're there. We do want to answer as many questions as we can today, but with the numbers that we have, it is possible that we may not be able to get to all of the questions that are out there today. But we have our contact information in the chat box. And so you can reach out to either myself or Andy, and if we didn't get to those questions today. So I am Allison Schaberg, Consolidated Planning Group. We are a holistic special needs planning firm. You may have attended some of our webinars in the past. We pride ourselves in putting out a lot of webinars and a lot of content surrounding special needs and special needs planning, the things that inquiring minds need to know if we have kids that are transitioning. I am a parent. I am a parent to 4, and I have 2 kids with disabilities. I have one that is transitioning right now, turning 18 next month, hard to believe, and I have one that has already transitioned. So a lot of these webinars were really born just from the simple fact of navigating some of these things is very difficult. And it's challenging, it's confusing, it is, and sometimes our life is difficult or challenging at best on the good days anyway. So that's kind of the why behind some of this. So having said that, because we are going to go from 12 to 1 today, I'm going to turn everything over to Andy right now, and he is going to take over and share his screen. So again, put your stuff in the chat box as far as questions are concerned. Today's meeting is being recorded. There will be an email that goes out later with the slides and the recording, and then the recording will later live on our YouTube channel, which is in the chat box, and it will be at the end as well. So thanks so much, Andy, and take it away.
thank you very much. Thank you, Allison, for inviting me out today, and thank you, everybody, for participating in this presentation. My name is Andy Hardwick. I am a public affairs specialist for Social Security in Southeast Texas. And today we're going to talk about 2 programs that we have for people with disabilities. And this involves children and adults. And when we talk about adults, for our purposes, we mean children that have reached 18 or older. Okay. If I can get the slide to move. There we go. Okay, so the 2 programs are Social Security Disability Insurance, or otherwise known as SSDI, and Supplemental Security Income, otherwise known as SSI. And they're not the same program, and they're not interchangeable, but sometimes a person can receive both benefits. Okay, so how is SSI different from Social Security? SSI, or Supplemental Security Income, requires a person to have limited income and resources, okay? It's not based on work credits. So if a person is a U.S. citizen, they do not have to have worked in the United States. In most states, if you are eligible for SSI, you are also eligible for Medicaid. So you don't have to file a separate application to get Medicaid coverage. Now, in order to be eligible for SSI, you have to be either 65 years old or older, in which case you don't have to prove a disability. But if you're under 65, you have to prove that you are blind or disabled. SSI comes from general revenues, not from the Social Security Trust Fund. So when people pay their Social Security taxes or FICA taxes, that is not used to fund the SSI program. So who can get SSI? Well, as we said, if you're under 65, if you're blind or disabled, and you meet our standards, you could possibly qualify to receive SSI. However, you would have to be a person with limited income and resources. In most cases, be a U.S. citizen. If not a U.S. citizen, have worked in the United States 10 years prior to applying. If you are 65 or older, again, and have limited income and resources, we could entitle you to SSI just based on your age. In order to receive SSI, you must be a resident of one of the 50 states, the District of Columbia, or the Northern Mariana Islands, okay? If you are living outside the United States, and for SSI purposes, St. Thomas, Virgin Islands, US Virgin Islands, Puerto Rico are considered outside of the United States. So you can only receive SSI in the 50 states, District of Columbia, and the Northern Mariana Islands. In most cases, you must be a citizen unless you were receiving SSI prior to August 22nd, 1996. Now, remember, we said that if you were under 65, you must meet the conditions for disability or blindness. So disability for Social Security means a physical or mental impairment that keeps a person from performing substantial work. This, of course, refers to people who are 18 years old or older. And the condition has to have lasted or be expected to last at least 12 months. Now, for children under 18 years old, they must have a marked or severe functional limitation, and this condition must be expected to last at least 12 months. When I say marked or severe functional limitation, SSA is going to inquire as to what their abilities are, and they're going to compare them to other children of similar age that don't have a disability. So maybe a 5-year-old should be expected to be toilet trained and be able to feed themselves to some degree. And, you know, so the questions will be geared toward that. Now, if this is somebody that's 10 years old, they would be expected to maybe read a sentence, be able to respond to commands, be toilet trained, be able to dress themselves, things like that. And then actually what SSA uses is a manual called Disability Evaluation under Social Security. Its nickname is Social Security Blue Book, and we'll talk about that in a few minutes. My screen got frozen here. Oh, there we go. Okay,
Andy,
so,
we have a lot of questions that are going to coming in, and I want you guys to keep putting your questions in the chat box, and we are going to get to them just as soon as possible. One thing I wanted you to mention, Andy, from an office perspective. So, I mean, there has been the Social Security offices have been closed right since the pandemic. So can you kind of talk about the best practices as far as engaging with the Social Security office right now, and when they hope to reopen to the general public for face-to-face non-emergency visits?
Well, that's toward the kind of the end of the presentation, how you apply
Perfect.
for SSI, but we'll talk about it. We'll cover that. So for right now, it's for someone that's alleging a visual impairment, it's vision of 2200 or less in the better eye, or field of vision less than 20 degrees. Okay, so how do we decide if a person is disabled? We don't make that decision in the Social Security office. An agency of the state known as Disability Determination Services, or DDS, makes those decisions using a manual called Disability Evaluation under Social Security, nicknamed the Blue Book, or Social Security Blue Book. So if you go to our Social Security website at ssa.gov or socialsecurity.gov, and under search, you type in Social Security Blue Book, or even Google it, put in Social Security Blue Book, you will see the manual that DDS uses to decide whether or not a person is disabled. Now, one section deals with children, that is children under 18 years old. The other one is adults, anyone 18 years old or older. Okay, it usually takes 3 to 4 months to get a decision, to get a medical decision on a disability claim, because what's happening is DDS is contacting the medical sources, the doctors, hospitals, clinics, and looking for evidence to see if how many of the bullet points or whatever you want to call it under that particular condition are found in the blue book. So the more similar the person's symptoms are to what's in the blue book, the greater the chances of being approved. Now, we have something under the SSI program called presumptive disability. There are certain conditions that are probably likely to be approved medically, all right? And if a person has one of these 15 conditions, while they are waiting for DDS to make a decision, okay, which takes 3 to 4 months, as I just said, we could pay the person SSI conditionally and entitle them to Medicaid. Now, remember, the person may meet the medical qualifications, but SSI, Supplemental Security Income, is an assistance program. There is a limit on what a person can have as far as income and resources. So even though they may meet the medical requirements, if their income or resources are too high, they will be denied on non-medical grounds on the SSI program. Social Security does not have any restriction on assets for the Social Security program, the SSDI, but the SSI program, yes, there are a lot of questions about income and resources that may affect how much a person gets, or even if a person can receive benefits, even if medically they appear they're going to be approved. Okay, so if a person meets one of these presumptive disability conditions, and we're not going to go over those today, but they include cerebral palsy, they include Down syndrome, low birth weight for newborn babies, and things like that. If they have one of these, if we have the medical evidence, we could conditionally pay the person up to 6 months while DDS is making a formal medical decision, and entitle them to Medicaid also. All right, we also have
Andy, can we talk about resources for a second? Because there is pretty valid question out here. Resources, are you talking about the parent's income or assets, or that of the disabled child?
We're not there yet. You're getting ahead of me. We will talk about that. Okay, so we also have compassionate allowance over 200 disabling conditions, where if a person has one of these conditions, possibly DDS could approve the case medically in less than 30 days. Because remember, I told you normally it takes 3 to 5 months, 3 to 4, but I think with COVID, it's more like 3 to 5. But with the compassionate allowance, they could get a medical decision as soon as 30 days or less. But go to the Social Security website, ssa.gov, type in compassionate allowance, and you'll see the list of conditions under that. Okay, so in order for the person to be eligible for SSI, they must have a countable income of less than $841 for this year, $841, okay? Now, for SSI purposes, we have 2 types of income, unearned and earned income. Unearned income refers to pensions, alimonies, support payments, rent, interest, annuities. Earned income refers to wages, any money that a person earns from work. So if a person applying for SSI has unearned income, we don't count the first $20. The rest is countable. So the SSI, the maximum SSI amount here in Texas is $841. If the person has Social Security, let's say of $820 a month, we don't count the first $20 because it's unearned income. That leaves $800. That's subtracted from the SSI amount, from $841. That gives the person an SSI amount of $41, and they continue with their Social Security of $820. But even if they get $1 from SSI, that would entitle them to Medicaid. Okay, so the amount of resources that a person can have, or assets, is $2,000 for an individual. Okay, if it's an individual, if it's a minor child with living with one parent, then between the one parent and the child, they could have a total of $4,000 in resources. If it's a minor child living with two parents, then between the two parents and the child, the resource limit is $5,000. Okay, now what does not count as a resource? The home where the person lives. Okay, they just have one home. We don't care what the value of the home is. The car. If they have one car, it doesn't matter what the value of the car is. If they have two cars, then the more expensive car is not counted. The less expensive counts as a resource. All right, so that if that has a value of over $2,000 and it belongs to the SSI applicant, that could make the person ineligible for benefits. Burial plots, we don't count. Burial funds, if you have a bank account and it's marked burial funds, as long as you don't touch it, we don't count $1,500 of that burial fund. Life insurance, if the face value is $1,500 or less, it's not countable. Again, I don't know who has life insurance for less than $1,500 or less, because that's not going to buy anything. If the face value is over $1,500, then the cash surrender value of that policy is counted toward the resource limit. Now, ABLE accounts, you can have up to $100,000 in the ABLE account, and that is not countable. Special needs trust funds, if they're set up in a certain way, we also don't count the money that's in a special need trust fund.
So I just wanted to clarify. So on the life insurance side of the house, from a cash value, so over that $1,500, but in the example of a term life insurance policy where there is no cash value, how is that addressed?
Good question, good point. A term policy has no value while the person is alive, so it's not countable at all. So you could have a term policy for a person who has disabilities for $100,000 or $200,000. We're not going to count it, because if it's cashed in, it can only be cashed in if the person dies. And if you cancel the policy, no money is gotten back. So it has no value at all, except in case of the death of the person. So therefore, you don't have to worry about term insurance. Okay.
And can you just address really quickly, because it's going in the chat box, child support as earned income or unearned income?
Yes. Child support is considered unearned income. And I just told you a few minutes ago that we don't count the first $20 of unearned income. But let's say a person has child support of $900 a month. Okay. Actually, with child support, we don't count 1/3 of it. So of the $900 the person receives per month, only $600 would be countable. Okay, so only 2/3 would be countable. The 1/3 of it would not be counted at all. So that's a special rule for child support. Thank you for bringing that up. Okay, the ABLE accounts, you set it up at the bank. They'll tell you how to set it up. You can put retroactive monies or whatever in that account. And that can be used for housing, education, healthcare, transportation, assistive technology, personal support for the person with disabilities. And now the total amount of contributions into that account per year, if you have several people putting into that account, they cannot go over $16,000 for the year. Okay. Now, if a person is under 18 years old, we count part of the parent's income and resources as though they were the child's. And this is what throws parents for a loop sometimes, because you may have a child with cerebral palsy that medically would be approved, but then the person at the Social Security office tells you that child is not eligible. And why is that? It's because of something that we call deeming. It means that we are counting the part of the parent's income and resources as though they were the child's. Now, once the child turns 18, that is no longer the case. Even if the child is living with the parents, still dependent on the parents, it doesn't matter. What the parents have no longer counts once the child turns 18. So once the child turns 18, how do we determine how much SSI they're going to get? Remember, we said that the maximum amount is $841. On the lower end of SSI, the payment is probably $600+ per month. So you can get between $600 and $800 and $841 a month if you have no income. Okay, but once you turn 18, the way we determine how much money you get paid depends on your living arrangements. So living arrangements are determined by sharing, rental liability, separate purchase of and preparation of food, institutionalization, home ownership. So there's different factors that can affect how much a person gets from SSI. As I told you at the beginning of the presentation, here in Texas, if a person is eligible for SSI, they're also eligible for Medicaid. Now, the Medicaid that covers your child in Texas will not work in another state unless you take your child to another state for a visit. If they're there for a visit, yes, Texas Medicaid will cover. But if you move to another state, the month of the move, Texas Medicaid will still cover, but the following month, it will not. So as soon as you move, you must notify Social Security in the new state so we can contact the Medicaid office and you can be issued a Medicaid card for your child in the new state. Right now, if a person is approved for SSI, they have a non-medical review of their case every 1, 2, or 3 years. That's to determine if there have been any changes in the household income, or if the person themselves that is the SSI recipient started working or started going to school or whatever. All those factors can affect how much SSI they get. So we have to do a review every 1, 2, or 3 years. Now, these reviews are being done by phone now. We are not doing the redetermination review in person. I'll explain to you why, but right now, Social Security offices are closed for walk-in traffic. Don't even think about parking at your local Social Security office, knocking on the door and expecting to be let in, because it's not going to happen right now. All right. Now, in addition to doing a non-medical review of the SSI, we do a medical review of the SSI, and that's every 3, 5, or 7 years. And that actually happens with SSI or SSDI. So if a person is getting Social Security disability, they get a medical review of their case every 3, 5, or 7 years. Now, SSI recipients who got SSI prior to their 18th birthday were determined to be disabled using the standards that we use for children. But once they turn 18, they're considered an adult. So the standard for disability then is, can they do some kind of work activity, and what level of work can they do? So SSI recipients who got SSI prior to 18, shortly after their 18th birthday, will get a letter from Social Security telling them that they must have a medical review of their case, because they are now going to be judged using adult standard. So it may be that their SSI continues, or it may be that Social Security says, well, this person doesn't meet the disability standards as an adult. Now, a lot of your kids in school that are in schools, in high school, might be in what we call transition programs. And this is where parents kind of freak out, because they say, you know, they try to get their children on the SSI program, and maybe they finally have, and they have Medicaid and everything's in place. And all of a sudden the school is saying, oh, we've got them as transition program and they're going to start working. And so the parents, you know, get anxious, because they say, wait a minute, if they start working, doesn't that mean that their SSI is going to stop? Not necessarily. Under the SSI and the SSDI program, we have work incentives. That means these are programs whereby when you start to work, we're not going to count part of your wages, because normally SSI counts the first $65 of your gross monthly income. If you have no other income, they don't count the first $85 of your gross monthly income. And then whatever is left is divided by 2, and that result counts against your SSI. So let me give you, for instance, let's say we have a young person getting $841 a month. They got a job and they're earning $885 gross per month. Okay, so their only income was the SSI and now what they earn from work. So that's $885 gross. Since that's their only income apart from the SSI, we subtract $85 from that $885. That leaves $800. We divide the $800 by 2. That leaves $400. That's what's counted against the SSI. So if the person that was getting $841 and got a job and was making $885 a month, starts to work, their SSI will be reduced by 400. Okay, so they'll still get their 885 gross from work, but their SSI will now be 400. We also have a plan for achieving self-support, continued Medicaid eligibility, student earned income exclusion. These are programs that we have where we don't even count the full amount of their gross wages for the month. For instance, if a student is under 22 years old and goes to work, as long as they're a full-time student and they're under age 22, we actually don't count the first $2,040 of their gross income for the month, up to a total of $8,230 for the year. So you could have a young person under 22 earning $2,000 a month, and basically it'll take 4 months and maybe a week or so before their SSI is reduced to 0 because of their earnings. Okay, so that's just one example. I don't think that many students will be earning $2,000 a month, especially while they're still in school, but that's just an example that I'm giving you, that up to $8,230 this year is not countable toward the SSI. So these impairment related work expenses enable a person with disabilities to work. We're trying to see if the person with the disabilities can eventually get off the SSI and SSDI programs. Now, I know that's not a realistic goal for everybody, but even if the young person can't get off the SSI and SSDI, they can continue to work, and this will be additional income because that added up with their SSI will be more than they got with just the SSI or SSDI alone. Okay, now these have to be approved by Social Security. And for instance, an impairment related work expense would be, let's say that my child has no way of getting to work except by Uber. Okay, there's no public transportation there, and there's no other way they can work. If that's approved by SSA, and let's say the cost of Uber is $400 a month, and the child is earning $885, but now they're over 22, so that exclusion that I just talked to you about is no longer available to them. But now that they earn, now that they have $400 that they spend for transportation, and that's approved by SSA, that means of the $885, we're going to count, we're going to start off with, we're going to subtract $400 because that's what they're spending in order to get to work. So that leaves $485. So $485, we subtract $85, that leaves $400. And we divide that by 2, that leaves $200. That's what we count against a person's SSI, against their, let's say, 841. So their 841 would be reduced by 200 even if they're earning $885 a month in gross wages, because they're spending $400 of that $885 for transportation. We approved it, so we don't have to count that part that they're using for transportation. We also have something called the PASS, a plan for achieving self-support. If a person who, let's say, is getting SSDI because their parent died or their parent is receiving a Social Security benefit, And now that person, let's say the person is getting $8,000, I'm sorry, 8,000, right? $1,000 a month from Social Security under their parent, okay? Then they come to us and they say, look, I want to go to school. I want to be a teacher. It's going to take 4 years. And I talk with the folks at the university, tuition and fees are going to be $1,000 a month. They submit that, then that means that the $1,000 a month that they are using for their tuition and fees for their schooling is going to offset the $1,000 that they get from SSDI, which means that they can now apply for SSI and possibly get Medicaid and $841 from SSI, while they're using the $1,000 a month they get from SSDI to pay for their schooling.
Let's, can we just chat for a quick second? Because we have people that get panicked about having a 529C for college for their kids.
Right.
And the 529C, when your kid is 18, the 529C is owned by the parent or grandparent or whoever set it up. If the 529C makes a disbursement to the college for higher education and not for room and board, is that counted against the individual getting SSI?
No, it is not.
Okay, that's something that comes up all the time, and it's a source of panic for many families that have saved considerably in a 529C. But I do want to say the 529A for ABLE, again, that's a bucket that Andy was explaining. You can have money in that account without, it causing any issues for SSI. But the difference between a 529C and a 529A is the individual with a disability is actually the account owner on the 529A for ABLE. So I wanted to mention that because it is confusing. And then someone said, can the 529C, can it be rolled over to the ABLE? And the answer is yes, it can. But the thing that you have to know, and this is important, if you guys have got kids that are kind of coming around the bend to age 18, you can only convert, roll it to a 529A, $16,000 a year, whatever the limit is for the year. That's how much you can move over to an ABLE. So if you've got large sums of money in a 529, you might want to start converting that sooner versus later because you're limited at the 16,000. But the cool thing about the ABLE, just so you know, is if it can be achieved, if you can achieve a better life for an individual with a disability, you can basically pay for it out of an ABLE account, which you can pay for college and tutoring and private school and any number of things. It could be it could be a vacation, it could be housing or rent or other things like that you can pay for out of an ABLE account without any penalties. Whereas on the 529C, if you don't use it for higher education, basically you're going to be taxed and penalized. So some people do like to think about that idea of converting. Okay, Andy, I'm going to turn it right back over to you.
Okay, thank you very much. Yes, and the plan for achieving self-support needs to be written up and approved by SSA. Right? Student earned income exclusion, as I said to you, if a student is under 22, they have to be a full-time student, either in college, which is 8 hours per week, or grades 7 to 12, 12 hours per week. We can not count up to $2,040 earned income per month, up to a maximum of $8,230 for the year. Okay, now for the SSI program, you must report changes in income, resources, living arrangements, because the amount of people in the home or the income that the person receives, or if they're under 18, what their parent receives, if that changes, that could affect the amount of SSI that the person is receiving. If the person leaves the US for more than 30 days, you must notify us, because if you are outside the United States for 30 days, for longer than 30 days, then your SSI is suspended, and so is your Medicaid, until you are back in the US for 30 days. Please let us know about changes of address also. Okay. Now, how do you apply for SSI? Go to socialsecurity.gov or ssa.gov. You can always complete the medical portion of the SSI claim online. You can always do that online. Now, if your child is under 18, or if you applied for SSI before, or if the SSI applicant is married, you will not be able to do the non-medical portion online. So what do you do in that case? After you complete the medical portion and you send it, now that's not the complete claim, that's only part of it. But after you send that electronically, you're going to have to call your local Social Security office or our 800 number to make an appointment. I know it's difficult, especially the 800 number. The waiting times can be extremely long. We're trying to fix that. But right now, it's we just ask your patience. Now, I promised you that I would tell you about Social Security offices reopening. We anticipate around mid-April of this year, we will reopen to the public. Now, in what form or how, I don't know. Just stay tuned to your news, local news, or to our website to see in what manner we will reopen. I will tell you that we'll still continue with the appointment system, but we will have room for walk-ins, but walk-ins will probably have to wait a long time, where the people who get an appointment will have first priority. Okay?
Andy, it's been said that if your child is turning 18, that it is recommended to call the Social Security office maybe 2 or 3 months in advance to schedule your appointment for the month that they turn 18. Do you agree with that, or do you have any good advice for the parents out there that might be coming up on this?
Absolutely, Allison, and that's a good point. Since the application probably will not be for a couple of weeks or possibly months out in the future, you can call prior to your child turning 18, maybe 2 or 3 months, but do not schedule the appointment to any month prior to when the child turns 18. It doesn't matter what day in the month the child turns 18, but not before the month in which they turn 18, because otherwise, if you apply in a month before they turn 18, we're still counting the parents' income and resources. That could create a problem. But if you're applying the month they turn 18, that makes things different. Okay, so make sure.
Okay, and let's talk about a couple of other things that come up too. For the families that are already getting SSI or SSDI, perhaps mom or dad's already retired or disabled, and the child is turning 18, what they have some requirements to notify the administration that the child is disabled. Can you talk about those situations if you're already getting SSI prior to 18 and turning 18?
Okay, yeah, we went over this when we talked about the medical review. All children who get SSI prior to 18, shortly after turning 18, will have to have a medical review, because DDS, the Disability Determination Services, will now be using adult standards to decide whether or not that child, who's young adult now, is still disabled under the adult standards. So you don't have to do anything. You'll be contacted shortly after the child turns 18. Now with Social Security, we're going to go into the SSDI portion, but until a child is 18, as long as they're a minor, if their parent collects Social Security, either retirement or disability, or the parent is deceased and they had enough work credits prior to their demise, their children can receive Social Security under their account, without proving a disability. So normally kids that are on disability kids that are on Social Security under their parent are looking at a cutoff at age 18 or 19 if they're in high school. But if they have a disability, it's up to the parent or caregiver to contact us and tell us this child has a disability, so we can complete the disability forms. And if those are approved, then that child will continue getting Social Security. But now they're classified as a disabled adult child, and they will continue getting benefits from Social Security for life, as long as they have that serious disability and they are unmarried and they have difficulty working.
Okay, so I have a few things. So people that are applying for the first time, whatever office you start with is where you stay. Is that correct? I mean, you can go to any office, but you're going to be coded to that particular office. So my suggestion is if you're applying for the first time, you might want to do your homework to find out. The office that's closest to you might not be the best office because they may be really an overwhelmed office. There may be other offices that are having sooner, quicker appointments or have higher, turnaround of getting things done. So you might want to do your research and ask other parents in the disability community what their experience has been, number one. Number two, because the offices are still closed, one of the questions that we get on a pretty regular basis is how do we get our documents in? And while it is true that you can walk your documents up there, it's true that you can overnight them and mail them. My suggestion is faxing them because faxing them puts them in an electronic queue. Can you talk about that, Andy, for a moment? Because I think that that's a big deal, getting your documents in and then obviously them acknowledging that they get them. Is it still true that faxing them in might be the best way as it stands right now with the pandemic?
Yes. And how do you find out the fax number or the phone number of your local Social Security office? Go to ssa.gov or socialsecurity.gov, scroll down to the blue boxes down below on the home page. One of them says contact us. Then scroll down to where it says office locator, put in your zip code, and it will show you the fax number, the phone number, and the address of your servicing Social Security office. So it is much better to fax documents in rather than mail them in because the mail is extremely behind. Only 1/4 of our workforce is working in office. The other 3/4 are working from home. So we don't have the personnel to go through the mail like we used to. The fax, it's a much quicker process and a more sure process. So I would say fax in your documents using the fax number that you're going to see on the office locator.
And we always say dealing with your local office, not the national office. Basically, when you call the national office, you're going to sit on hold for about an hour, and then they're basically going to tell you that you should talk to your local office. So always deal with your local office. Then we have a million questions, but one question that we had was about a step parent. We hear this on a regular basis. When you were talking about Social Security benefits and kind of childhood disability benefits under a parent's record, who can qualify for that? Is it bio parents if you've got guardianship, or custody of a kid? And what about step parents? That's basically
you don't have to have guardianship of a child. They don't have to be living with you in order to get benefits under you. So just because a child, you don't have to prove that child. So if you can prove that is your child though, and you are receiving benefits, they could receive benefits under you without a reduction of your own benefits. Now, as far as a step parent goes, I don't know. I would have to check into that and see, but I will tell you that for deeming purposes, if a child is under 18 and the step parent is living in the household, we do count the income and resources of the step parent as though they were the biological parent. If that parent is living in the household and the child is under 18. Like I said before, once they turn 18, that no longer applies. Or if a child is being raised in a non-parent household where there's no parents or step parents, we're not counting the income and the resources of the person who's raising the child, because today, in many cases, it's the grandparents or some other relative. We're not counting the income or resources of that non-parent relative or non-parent caregiver.
And
Okay.
and if you could check on that, it is my understanding that for Social Security disability purposes, that it could be the bio mom or step parent, or bio dad and step parent. And then in the example that, let's say, grandparents have custody of a grandchild or something like that, that basically the grandchild could draw off of the grandparent's record. That is my understanding in the research that we've done. So if you'll let us know that, we'll put that out to everybody in an email, and we'll let you go ahead and continue, and then we'll get to the questions at the end.
Yeah, there are certain cases where grandparents can receive or grandchildren can receive benefits under their grandparents, but it depends on the situation. Okay, so Social Security. Social Security is a work program. In order to receive Social Security, you or the person under whom you're filing has to have worked and gotten enough work credits. So children can draw under their parent if their parent is receiving benefits and the child is under 18 or under 19 and they're still in school. Okay, if the parent is collecting retirement or disability benefits. Okay, now if the child's parent has passed away and they had enough work credits before they passed, the child could receive survivor benefits under 18 or 19 if they're in school, just based on the fact that they're a minor child. No disability needs to be proved. But if they want to keep receiving benefits after 18, they must prove that they are disabled. So in that case, the parent or the caregiver would contact SSA and the child, and then they would fill out the disability forms for the child. If DDS approves it, then the child is classified as a disabled adult child, and then they could possibly receive benefits under the parent for life. Or if the child is under one of these transition programs, starts working, these employers are taking out Social Security insurance. They're paying the Social Security taxes. So if the person gains a certain number of work credits, a young person, they might be eligible for their own Social Security disability, their own SSDI. It's not going to be a whole lot, okay? But they could be eligible for the SSDI, all right? So again, this is what I just said, that if a parent is receiving Social Security for themselves, disability, retirement, the child could get it until 18 or past that if they have a serious disability. Okay, so if the child, now, even if you have suppose you have a child that's 29 when you start getting retirement or disability, or perhaps you or your spouse passes away. If that 29-year-old is single, has difficulty working because of a disability, and they can prove that that disability started before they were age 22, they could receive benefits under their deceased parent or their parent with disabilities or their parent who was getting retirement benefits. So they could get benefits even though they're over 22 years old, okay, even if they're 40 years old, as long as they could show that that disability began before they were age 22. Now, after 2 years, after 24 months, the disabled adult child receives Medicare, okay? So a child on SSDI, or young person, I should say, on SSDI, let's say the earliest they can be classified as a disabled adult child is 18, not any earlier, okay? So as early as age 20, if they started getting, or they were getting Social Security as a minor, now at 18, they were reclassified as a disabled adult child. At age 20, they would become eligible for Medicare. Actually, they would be enrolled. We enroll them in Medicare Parts A and B. Okay, so can a person receive Social Security and SSI at the same time? Yes, if the Social Security is less than $861 a month, between the SSI and the Social Security, they would add up to 861 in many cases. All right. Now, oops, one thing I forgot to update here.
Can I ask a question for a second here, Andy? We had a question on Medicare. If you're getting SSDI, but you never worked, can you get Medicare? Will you still get Medicare after 2 years?
Yes, if you're getting it under your parent, after 24 months, you would become entitled to Medicare under your parent, okay? And if you're still on SSI at that point, SSI will pay. Medicare is not a freebie like Medicaid. So it has co-pays, deductibles, things like that. That would be covered by the Medicaid, and Medicare would be the first payer, okay? Now, I'm sorry I didn't update this last bullet point. It should be the countable income can't exceed $841 for 2022. Okay. Now, as I said, the child becomes eligible for Medicare after being classified SSDI and receiving benefits for 2 years. Now, what happens in a lot of cases is the SSDI amount is so much that it results in the SSI being cut completely. Okay, so of course the parents' worry is, well, wait a minute, if they get cut off of SSI, they're going to lose their Medicaid and they're not going to have Medicare for 2 years. So what do? If a child becomes eligible for Social Security disability under their parent, okay, and of course the child has to be at least 18 years old. If the only reason the child was cut off of SSI was because they're now getting SSDI under their parent as a disabled adult child, they can continue on Medicaid, even though they won't be seeing an SSI check every month. As long as they keep the SSI rules, they can stay on Medicaid. So that will cover them for the 24 months while they're waiting for Medicare. And then if they choose to keep the Medicaid, as long as they keep the SSI rules, the Medicaid will cover the co-pays and the deductibles and the premiums for Medicare. So, you know, that's a good deal. All right. So for a person to get their own Social Security, in order to get one credit, they have to earn $1,470 in 2021. This year, it's a little over $1,500. Let me see what the amount is. And that's another slide that I have to update here. I apologize. It's $1,510. So this year, for every $1,510 a person earns, they get one work credit. And once they reach 6,000 plus, which is the 1,510 times 4, then they get 4 credits for the year. The most credits a person can get is 4. So even if I make $100,000 this year, the most credits I can get is 4. All right.
Andy,
so,
I think it's important that we take a pause here for a second, because this is something that you and I have talked about before. And we're trying to explain it, but the main thing is to understand, and this is what Andy was saying, is a lot of times families, because this is very confusing, we have disabled kids, so we naturally think that Social Security disability is what they should naturally get. That just makes sense. But I just want to clarify these names again, because we're throwing them around and they sound the same and they're not the same. So SSI is Supplemental Security Income. That was what we were talking about before, and it's the individual is disabled. Basically, they're indigent. They're meeting the asset check for SSI. So SSI, Supplemental Security Income. SSDI, also known as Social Security, sometimes known as Retirement Survivors Disability Income. That is a worker-based program. You work and pay into that, and that is what Andy is explaining. So when a person initially applies for SSI, basically they apply for SSI and SSDI, and usually what happens is the first letter that you get in the mail is the denial for SSDI. And I have had people calling me crying about this denial, like, how could they say that this kid is not disabled? Are you kidding me? They're very, very upset. But basically, you're just getting the letter that you should get saying that the child is denied because the child has never paid into Social Security disability. That SSI letter of approval comes after that SSDI. So there is a lot of confusion with these terms, and I just wanted to make sure that you guys are clear that we were talking about SSI before, and now we're moving over to that SSDI part of this. And there's a lot of confusion in the chat box too, so I just wanted to chime in there and talk about that, Andy.
Yes, and thank you for that clarification. That's right. That just look at the letterhead. It will say Social Security on it, and it will say that case is denied or the claim is denied because there's not enough work credits. But that has nothing to do with the SSI application. The SSI application is still pending. That's going to take 3 to 5 months unless it's a compassionate allowance or presumptive disability. Then possibly quicker than that. But otherwise, yes, the Social Security, you have to have worked and earned it. So either you or the person under whom you're filing. So like for a young person under 24 to get their own Social Security, they just have to have 6 work credits. So if a person under 24 has worked 2 years, it's possible that they have enough credits to qualify for their own Social Security disability. Like I said, it's not going to be a whole lot, but you know, it's something. All right, so all right, we already went over this, and Medicare has 4 parts, A, B, C, and D, and we're not going to go over that. Here's our website, socialsecurity.gov or ssa.gov. There's our 800 number, 1-800-772-1213. Or, as I said, you can go to those websites above, scroll down to contact us, then scroll down to office locator, put in your zip code, and you will see the phone number of the office that's located nearest your home, nearest that zip code, that services that zip code, and that's the office that you're going to be dealing with. Okay. So Allison, I know we don't have much time.
Yeah, you know, I think what we're going to do from a question perspective, and you can stay on this slide just for a second, but from a question perspective, we have a lot of awesome questions out there. And so, and not enough time to get to all of them because we stick pretty hard to the 1 o'clock ending time. So what we're going to do is we're going to download those questions, and Andy and I are going to answer them, and we will attach that in our email that we send out. So we'll answer as many questions as we can. There was somebody that said that they were getting SSI before, and then the parent died, and they switched over to RSDI, and then they lost Medicaid. And basically, is that right? That shouldn't have happened because of the Pickle Amendment?
Normally, Social Security contacts the Medicaid office, Health and Human Services, and they let them know that this person should stay on the Medicaid program. It doesn't always happen. Once in a while, we have little blips there. If that happens, then all you have to do is contact the Texas Department of Health and Human Services and say Pickle Amendment. Under the Pickle Amendment, if the only reason that the child was cut off or the young person is because they became entitled to Social Security under their parent and they're at least 18 years old, that Medicaid should continue. All right. And I have, I put my email in the chat box. I can mail you a copy and email you a copy of that provision that protects those young people.
And Andy, if you would just forward the slides a little bit, you can just keep them moving to the last page. We have one more. We have a YouTube channel. We have, and our YouTube channel is free, so you can subscribe to it for free. We have all these webinars, a lot of detail on all these topics, deeper on ABLE accounts and other questions that you guys have asked today. We are certified as National Social Security Advisors, and we do have specialized software that will help us determine how and when you should pull the trigger on Social Security in the future. I'm taking into consideration a disabled adult child, and also if we had a parent that was a caregiver. So you can reach out to us directly. You can take a picture of the QR code on the screen, and we have free personalized consultations. I know that everybody has their own individual needs and story and denial and questions and fear of applying for all of these things, and these are things that we deal with every day. That's what we do, so we can definitely help you with that. So again, we are going to download your questions. We just had so many people on here today and so many great questions, we couldn't get to all of them, but we will answer those, and we will put that out there in the email to everybody. And I would just like to thank you again, Andy, for being here and for being awesome, and thank you everybody for spending your lunch hour with us. Take care, and we will talk soon.
Thank you very much.
Thank you.